PARCA, Clinical Section 1.3 covers medical terms. LBP, STAT, WBC, CPR, LLQ, PHGU, PO, SOB, WC, Aiden, spasm, nephro, megaly, plegia, and IAC. Section 1.4 is what PARCA calls clinical terms, and there are a lot of suffixes and prefixes, but there's suffixes in this list too, so I'm not quite sure exactly what differentiates medical terms and clinical terms in PARCA, but these are the medical terms we're going to talk about. LBP stands for lower back pain. STAT means urgent at once. Do this chest x-ray. STAT means drop everything and do this one now. WBC stands for white blood cells. CPR is cardiopulmonary resuscitation. LLQ is left lower quadrant, and there's a whole series of those. There's RLQ, right lower quadrant. LUQ, left upper quadrant. So there's a bunch of those. pH stands for hydrogen ion concentration. GU stands for genitourinary. PO stands for post-oral. What most of us think PO stands for is by mouth, and that's sort of more how it's used in the United States of America, but in Europe, PO often means post-oral. SOB stands for shortness of breath. Aiden is a part of term word for gland. So part of term words they make up part of a larger word, right? So Aiden is one part of a word. WC stands for wheelchair, and spasm is an involuntary contraction. Nephro is a part of term word for kidney. So nephrolithiasis is kidney stone, right? And it starts with nephro. So anytime there's nephro, there's kidney. So nephromegaly. Megaly is another part of term for enlargement. So you can take two parts of terms and put them together and make a word out of them, right? So nephromegaly would be an enlarged kidney. Plegia is part of term for strokes, like you might have quadriplegia, paraplegia, hemiplegia. That's part of term for stroke. IAC is part of term for afflicted with a certain disease or illness. So you might be a hypochondriac, or you might be a hemophiliac. And so AC is part of term for afflicted with a certain disease or illness. And those are the medical terms. Thank you for watching.